Welcome back to Understanding Exceptional. I'm Dr. John. Today we're going to talk about private evaluations or evaluations conducted outside of the schools and what the schools have to do once they've received an evaluation from an outside provider. One of the questions I frequently get from parents that come to my practice to have a private evaluation done is, once you're done with your evaluations, you provide your diagnoses and your recommendations, do we just simply take that document to the school, the report that you provide, and then they just do what you tell them to do? The short answer to that is no, that is not the requirement by law. The longer answer is, anytime there is an evaluation conducted outside of the school, as long as that individual possesses the appropriate credentials, they're a psychologist or even a school psychologist outside of the school then has to accept that evaluation and now review it to determine if that evaluation includes the data they need to determine if your child is eligible for special education and what your child may need in terms of adjustments to the curriculum through an individualized education plan or program, IEP. So again, once you've had an outside evaluation done, when I conduct an evaluation, what I do is I write mine so that when parents provide it to the schools, that it has all the data the schools are looking for and require to make decisions related to a child's eligibility first. First, you have to establish eligibility. And secondarily, what their needs may be based on the findings of my evaluation. So the schools absolutely do have to accept the evaluation, and then through a formal process, through a meeting, which will be a multidisciplinary evaluation team meeting. I've done a separate video on those METs and what those involve. But through that MET process, the team will review the data obtained and determine if that data can be used to determine special education eligibility and what the student's needs might be in the classroom. Now, keep in mind that the special education system and the clinical diagnostic system that I use are two very separate things. They overlap, but they are separate. As a brief example, if I diagnose a child with ADHD, well, there isn't an ADHD category in special education. That would be covered under the other health impaired category. So in other words, the diagnoses that I use aren't applicable to the special education law. Let's take another couple examples. If I diagnose a child with dyslexia or a specific learning disorder in reading, that diagnosis would fall under the specific learning disorder category, subcategory of reading under special education law. So when I use a term like dyslexia, there isn't that term in special education. So I have to use their terms so that parents have what they need when they provide the evaluation or the report to the school to ensure that the team understands that their child is or is not eligible for special education and what their needs may or may not be. So this raises an important point. When you're seeking an outside evaluation, you're going to be going to a psychologist or a neuropsychologist or somebody outside of the school district. You're going to want to find out, do they understand special education law? And do they relate their findings directly to the categories in IDEA, or Individuals with Disabilities Education Act? When I write a report, I include not only my clinical diagnoses, but I also include what educational categories the child would be eligible under and what their needs may be in the instructional setting. At the end of the day, if you have a kiddo who is neurodivergent, a lot of their needs may be met in the school setting. So it's important that a clinician outside of the school understands all of those laws, policies, and procedures and can relate their clinical findings to the special education taxonomy or their diagnostic or eligibility system, and relate their clinical findings to how that might be remediated or addressed in the educational setting through curriculum adjustments. So it's important you find out whomever is going to be doing the evaluation, do they understand and do they bridge the clinical with the educational worlds? So to summarize, if you have an outside evaluation conducted, whether it's through insurance or you're paying privately, you can take that report and the data contained within and provide it to the school. The school's requirement is then to review that data through an MET meeting and determine if that data is sufficient for them to determine eligibility and start to address the needs through an IEP. Hopefully there was something informative in there and you took something out of that. As always, join us at understandingexceptional.com. Get involved in the conversations, make a comment, ask a question, agree, disagree, subscribe. Looking forward to seeing you on future videos.